Welcome to Season 16 of the 5-Minute Biographies podcast. Episode 3. Florence Nightingale.
Florence Nightingale, a name synonymous with compassion and healthcare reform, revolutionised the field of nursing during the 19th century. Often hailed as the Lady with the Lamp for her tireless night rounds tending to wounded soldiers during the Crimean War, Nightingale's impact extends far beyond a single conflict. She was a statistician, a social reformer, and a pioneer who transformed the perception of nursing from a subservient role to a respected profession. Born on May 12, 1820 in Florence, Italy, Nightingale's upbringing was privileged. However, a strong sense of social responsibility and a calling to serve the sick manifested early in her life. Despite opposition from her family, who envisioned that a more traditional path for a woman of her social standing, Nightingale pursued her passion for nursing. She defied societal expectations by travelling to Germany to train at the Institute of Protestant Deaconesses in Kaiserswerth, a renowned institution focused on religious and social service. The Crimean War, which lasted from October 1853 to March 1856, was a pivotal moment in Nightingale's career. Appalled by the dire conditions wounded soldiers faced, she volunteered her services and, in 1854, arrived at Scutari, a military hospital near Constantinople, with a team of 38 nurses. What she encountered was a scene of utter chaos and neglect. Hospitals were overcrowded and unsanitary, with infection rates soaring. A meticulous record keeper and data analyst, Nightingale meticulously documented the appalling conditions and mortality rates. Nightingale's revolutionary approach focused on improving sanitation and hygiene. She instituted basic measures like proper ventilation, hand washing, and cleaning, dramatically decreasing mortality rates. Her statistical analysis, often presented in innovative visual formats, compellingly conveyed the impact of improved sanitation. Nightingale's dedication and tireless work not only saved lives, but also challenged the prevailing perception of hospitals as places where soldiers went to die rather than recover. Nightingale's legacy extends far beyond the battlefields of Crimea. Upon her return to England, she tirelessly campaigned for healthcare reform. She recognised the need for a well-trained and professional nursing workforce and, in 1860, established the Nightingale School of Nursing at St Thomas Hospital in London. The school, the first secular nursing school in the world, emphasised scientific principles, hygiene, and compassionate patient care. Nightingale's curriculum set a new standard for nursing education, attracting women from all walks of life and paving the way for a professional nursing career. Nightingale was a prolific writer, producing numerous books and pamphlets on nursing, public health, and hospital administration. Her writings disseminated her knowledge and influenced policies and practices worldwide. She advocated for improved sanitation in hospitals and homes, recognising the link between hygiene and public health. Nightingale's influence extended beyond Britain. She corresponded with healthcare leaders across Europe and North America, sharing her ideas and advocating for reform. Florence Nightingale's personal life was a fascinating mix of dedication to her cause and a constant struggle against societal expectations. While she wasn't known to have had any romantic relationships, she did maintain close friendships with several women throughout her life. One of her closest confidants was Mary Clark, a fellow nurse who worked alongside her in Crimea. Their letters reveal a deep bond and mutual respect, with Clark often acting as Nightingale's sounding board and confidant. Nightingale's family life was complex. Though she loved her parents, their desire for her to marry and settle down clashed with her unwavering commitment to nursing. This tension remained a source of friction throughout her life. Nightingale's life and work were not without controversy. Some historians argue that the Lady with the Lamp image, overshadows the significant contributions of other nurses who worked alongside her in Crimea. Additionally, her rigid and hierarchical management style could be seen as authoritarian. However, there is no denying the transformative impact of her work. She elevated nursing from a menial task to a respected profession based on scientific principles and dedicated patient care. Her experiences in Crimea unfortunately compromised Nightingale's health. She contracted a form of brucellosis, often referred to as Crimean fever, which left her with chronic fatigue and pain for the rest of her life. This illness forced her to live a largely reclusive existence after returning from Crimea. Confined to her home in Mayfair, London, she continued her work through extensive correspondence for much of the latter part of her life. Despite her physical limitations, she remained a powerful voice for healthcare reform. Florence Nightingale died peacefully in her sleep on August 13, 1910, at the age of 90. Though offered a state funeral and burial in Westminster Abbey, following her wishes, a more modest service was held at St Paul's Cathedral. Nightingale was buried in the family plot at St Margaret's Church in Hampshire, England. Florence Nightingale's influence on modern nursing is undeniable. Her emphasis on hygiene, data analysis, and professional education laid the foundation for the nursing profession as we know it today. Her unwavering dedication to improving patient care continues to inspire nurses around the world. International Nurses' Day, celebrated annually on her birthday, is a testament to her enduring legacy.
Thanks for listening to the 5-Minute Biographies podcast at 5minutebiographies.com and on YouTube at 5minutebiographies.com/YouTube.